Hello, my name is Geraldine Rogers. I am the Director of Nursing for Leadership and Quality here at the East of England. I and a wonderful group of people work together to support Catherine Morgan, our Chief Nurse, to achieve and address our action plan to support equality, diversity and inclusion across our region. There is much to do in this space, and we continue to do whatever we can to make a difference. This year, I'm delighted to say we've got a new fellow, and Tendai has joined the team. We're so privileged to have her input and expertise to be able to make a difference in this very important area, and hope to appoint a second fellow in the coming months to be able to work with Tendai and the team to work and bring our plan into fruition. This year our colleagues have been looking and getting to undertake the Getting Into Equity programme. 7 members of the internal team have taken the course so far, and many of our ICSs have also been involved in the programme. We've heard wonderful feedback on the growth and development and the greater awareness of what people are doing to be able to address anti-racism in their workplace. It's really important that we do this. We've also been involved in working with the national team on the creation of the national guidance to support anti-racism in practice. It was a real privilege to be part and to hear that work in its infancy to its true development, and we have and will continue to really support that and bring that guidance to life as the year proceeds. So what is it for next year and what do we need to do? Obviously get our 2 fellows into the region, have a real refreshed approach even, to explore our leadership programme. We're going to be working with our Deputy Dons, seeing what we can do and what is the art of the possible to improve EDI in their respective trusts, ICSs, etc. We're also working with a firm looking at cultural intelligence and how best we can support our international nurses as they take that brave step, as I once did, to be able to nurse in England, and how we can best support them. We'll be undertaking an evaluation of that development work and seeing how that has made a difference in practice. We will continue to learn, to grow and to develop, and for that we need a wonderful team around us, and we're very fortunate that we have that in place. So we will continue to do the do, and we look forward to seeing what we can achieve this year to work on this important agenda. Thank you.
Hello, my name is Kirsty Cater and I am the Deputy Regional Chief Midwife for the East of England. My portfolio is workforce and leadership, and I work with 6 senior clinical leads who all have an area of recruitment and retention that they are focused on. What's really important to me is EDI is the golden thread that runs through every single one of those work streams. We work really closely with Tendai, and in terms of leadership, we have supported the East of England Perinatal EDI Staff Development Programme, making sure all trusts have representation at that programme. We're also working to support the increase in representation at Band 7 and above level. We have a large amount of internationally educated midwives within the East of England, which I'm extremely proud of because it offers us such a rich and diverse workforce. However, we need to make sure that we are supporting those midwives in practice to make sure that their cultural needs and their integration is smooth and that they feel a real valued member of the workforce in the NHS. We're making sure that we have targeted PMA support for those midwives as well, and making sure that we are linking in with them really regularly. I'm very proud of the work that we're doing in the East of England, and I'm dedicated to continue to support that work.
I'm Yasmin Leons, Consultant Obstetrician at East and North Hertfordshire NHS Trust. and a National Maternity Improvement Advisor with NHS England. I co-chair the East of England Task and Finish Group for Ethnic Minority Staff Development for maternity and neonatal staff, or as we call it, Global Majority or Black and Brown staff, whatever terminology we wish to use. In the East of England, we're committed to ensuring that our staff are equipped with skills to flourish, to develop, and to ensure equal opportunities for them, and that they're valued and seen for who they are. In the last year, we have finalized and shared the Band 7 Equity and Inclusion Ambassador role to promote inclusive workspaces and to signpost for developmental opportunities. So, for example, one of our ambassadors has recently started the Florence Nightingale program, which we're proud of. We've also arranged webinars for our staff, learning from other regions, looking at what good looks like for our equality ambassador roles, but also how we can support our staff in the workplace. We've also learned from landmark cases of racism, sadly, in nursing and midwifery as part of our anti-racism strategy. But more recently, I'm proud to say that we have launched our perinatal EDI program for our Band 6s, Band 7s, and also for doctors, for middle grade doctors, to ensure that they develop the skills such as learning how to think strategically, learning the value of a mentor, learning quality improvement, and learning how to make an impact in the region and also nationally. We have currently 18 midwives, we've got 3 neonatal staff and 2 obstetricians on the program, which we're proud of through MDT approach. This work would not have been possible without our National Lead for Equity, Wendy Olaiwala, our Regional Chief Midwife, Wendy Matthews, Kirsty Carter, Deputy, more importantly, Tendai Ziwara, who's been program managing all of this and putting it together. And also to everyone in the region who've contributed to the development of this program. We're grateful to everyone. We'll continue to monitor the success of that, and we will see how we get on, and we want to make sure that we're meeting the needs and the aims and ambitions of the equity strategy. Thank you.
Hi everyone, my name is Anisi Power. I work at Bedford Hospital on one of the care of the elderly ward as an acting ward manager. I was recently on the NHS East of England Florence Nightingale Burn Leadership course. My experience of being on the course is that I felt it was very inclusive. Everyone from different backgrounds was on the course, from different hospitals and different hierarchy positions within the NHS. I also felt that the course gave us equal opportunities to express ourselves, share our knowledge, experiences, and also our skills. We were all acting like a family. What I've gained from being on the course is that I can now effectively manage the ward and adjust my leadership skills to meet the needs of the patients, the staff, and their relatives. In turn, this helps us to enhance the care that we provide for the patients. I have also found my voice, and I'm able to confidently speak to the senior leaders within the NHS. My advice to anyone that wants to be on the program is that do not be afraid to aim higher. When you're on the program, participate fully, because this will help you develop both individually and professionally. And also don't forget to celebrate your achievement. Thank you.
I can confidently say that the program exceeded my expectations. I learned a lot from the seasoned facilitators and gained very meaningful insights from my peers and our guest speakers. The course enabled me to grow both personally and professionally, and I will forever be grateful to the Academy for that. The learnings and experience will always be a part of whoever I'll be 20 years from now.